So we now have time for the attendees to drop questions into the Q&A for either of these doctors to answer as best they can. Now, this is preliminary information you're giving us. This is the hot stuff. This is not published yet. You're not finished. So you have permission to say, we're not sure yet.
Yeah.
That,
Therese, do you want to go first or do you want me to take a stab?
that might be our answer to many of these questions. So let's see. Go ahead, Amanda.
Yeah, I mean, as Jason, thanks so much for having us and just having the opportunity to share some of this early work is really exciting and to get some feedback from the audience. It's something we're really looking forward to. But yeah, as Jason said, this is super preliminary, and a lot of the kind of limitations that we're coming up against have to do with just like data availability in this space. So the CCBHC data we have is actually pretty good because CCBHCs have to have a designation, and so a federal designation. And so we know kind of the universe of CCBHCs, but we're struggling a lot more in the community safety response space. And then eventually we're hoping to open this up to other types of non-police crisis response. And so figuring out not just what those programs are, but also the communities that they're serving is something that we're struggling with a little bit. So I don't know if anyone in the room has suggestions of other ways we can build more universal directories. And I know there's some great organizations out there that are doing that work, and we are relying on your data too. But we'd be very much welcome to hearing any insights.
Yeah, aside from calling every county manager in America, I think you're going to be short. That
Yeah,
it's a horrible task to try to count this up because nobody intended this ever to be known about. I mean, in a sense,
yeah.
these things were built independent of each other, often without consultation over decades. So here's my basic question, though. We've had mobile crisis in America since the 1980s, and maybe before that, in various iterations. But now there's this new thing, this post-George Floyd thing, that is somewhat different, but mostly the same. How did this new thing get developed completely ignorant of the first thing?
It's a great question, Jason. I think something that, Amanda and I sort of touched on in the presentation, but in our work and understanding what each other's studies realized that there was this very, very separate conversations were happening across this space. So I don't know if I have the answer to how that happened or why it happened. But I guess one benefit that came from it
Hmm.
is greater knowledge and awareness of the public that programs like this do exist and that we can continue to understand what the landscape looks like across the country to hopefully bring these services to more folks so that they can reach them. I know Amanda was just talking about like our challenge and kind of the data sphere of things and looking at what programs look like across the country. Just through your conference, I learned about a new cataloging of programs that will certainly integrate into this data. So we're constantly learning more. And although I don't know why, I am excited that something has brought us all together here.
Amanda, do you have any thoughts on this separation of duties, this history?
Yeah, I mean, I think I can speak more about the kind of the CCBHC policy arc just because that's the space I know a little bit better. But interestingly, we see that the CCBHC um, kind of evolution didn't really precede George Floyd in the same way that community safety response programs have. We see like the first clinics receive their designations in 2016, 2017, and then a real growth since then, as we showed in one of the figures. And I think that's largely because CCBHCs provide all different types of services, and crisis is just one of nine categories that they have to provide.
Mhm.
Um, but but that doesn't mean that everything that they're doing, especially in the mobile space, isn't being affected by that huge increase that we see 2020 post. And so that's part of the reason why we're doing this work, is to really better understand the evolution of these two spaces that are often happening, at least in national conversations, quite separately, to figure out how responsibilities are being divided across local actors and what that means in terms of access, quality, equity for the communities that they're serving.
Do you think you'll be coming to a policy recommendation about the continued siloing of these two movements?
Therese, correct me if I'm wrong, but I think that's what we're trying to figure out in the project, right? So I think right now we're really just, where are these things? Like, where are the places where organizations have the opportunity to coordinate their services? And then from there, the goal is to do some qualitative interviewing to really figure out what that division of responsibility looks like, and then eventually to get at outcomes. Like, do we see better outcomes in places with consolidated service delivery, or is there real benefits to having multiple types of non-police crisis responders within the community? Are they serving very distinct purposes? I do not feel like I have any data yet, really, to come up with a policy recommendation. But Therese, correct me if I'm wrong. To me, I see that as kind of the primary objective of this overarching project.
Yeah, 100%. And I think one thing we're interested in understanding is what factors predict or contribute to how this national landscape of whether it's areas are only served by CCBHCs, community safety response programs, or both. And of course, at this point, we're not even accounting for other programs we haven't yet, included in that data, but to get a better sense of where these programs are popping up and why they might be, to be able to help inform some of those potential policy recommendations.
And just for folks at home, that when we say the term CCBHC, this is a federal Medicaid agreement with mostly with community mental health centers. So you would be seeing this in a place such as Cascadia Health, which we just saw. They are a CCBHC program, whereas I think People USA, Steve Michio's program from New York this morning, I think they're not a CCBHC.
I'm not
I might
sure.
be wrong
I
on that.
can no, I can check my list. But yeah, Jason, that's exactly correct. And we had a table in our presentation where we try to start thinking through and walking through some of the major distinctions between the two types of organizations that we're looking at in this project, in this particular presentation. And that is one of the main ones, is where is the team housed? And in the case of CCBHCs, because the majority of them are historically outpatient providers in mental health and sometimes substance use disorder treatment services, that is quite different than where we see community safety response programs being housed.
I want to ask about Texas because they were early adopters in the CCBHC, and we see that big color scheme all over Texas. Texas has mobile crisis in every county, right?
Yeah. So that's something that we're trying to figure out what to do with.
What do
To
they
be
mean by
completely
mobile
honest.
crisis?
Exactly. Yeah. No. Exactly. So Texas, as Jason said, was the earliest adopter of CCBHC. Really, they actually went about it in a slightly different way than everyone else, not through a federal. What is called the federal CCBHC demonstration, but they decided to do it themselves through a Medicaid flexibility. And I'm happy to talk about this more with anyone who might be interested in it. But that's why we see universal CCBHC coverage in Texas. And there's only, I believe it's 4 states that have universal coverage, Texas being one of them. And so that's why we have really great access to CCBHCs in that state. And Texas also has some type of statewide community safety response program that's within the data set that we included for this project. What we don't fully know at this point is exactly what that community safety response program means, both nationally and locally. And so that's why we have that orange color in Texas, because of these 2 statewide initiatives related to CCBHCs and community safety response programs. But what that looks like in practice, and that's why the qualitative work is going to be so important, I think Therese, I assume you agree it's kind of a mystery.
No, I think when you call the counties in Texas, you'll find with a little investigation that most of them would define their program. We would call that here in Oregon a co-response program, where police are going out with a mobile team on every call. There's some exceptions. Harris County Heart Team. There's an Austin team in Austin, but there's no like mobile, not a civilian mobile crisis teams. These are not civilian mobile crisis teams.
Yeah, thanks for pointing that out, Jason, because that's something that Teresa and I are very conscious about in this project is we really only are interested in the civilian only response programs, and so we definitely need to comb back through that data to make sure that's exactly what we're capturing and not
Mm.
bringing in co-response or other types of teams that involve law enforcement.
I had a wonderful talk with the head of mental health for South Carolina a couple of weeks ago, and we were talking about all the great mobile crisis teams in South Carolina, how long they've been going back to the early 1980s. And it wasn't until 30 minutes in the conversation where she told me that they were all, police officers were driving the car in all
Yeah.
instances.
Oh, yes, very different, type of service and program there. And another good reason why this is still preliminary and not published yet, because we want to make sure that we are accurately characterizing these services, especially in the areas where we're seeing the overlap and making sure that we are capturing sort of like distinct
Let me
programs
ask
and how
about
they all.
California then, because they have, my understanding is the California law is that they have the Miles Hall law is that they have mobile crisis in every county, and yet they don't. But San Francisco has 19 types of mobile crisis. Their fire department is going they got all alarms going. They've got 9 teams.
Yeah. Yeah, I mean, so for the sake of this presentation, we were really relying on that the CPE data set and what was in there, but that's why we're really excited to kind of continue to build it so that we're doing our best job to make sure we're capturing exactly what we as researchers want to capture, which might be different than any particular directory. But that's something we came across is we're not getting at kind of the quantity of mobile crisis responders within a community. So should we be grouping places that have one with places that have 12? Um, and we don't have a good answer for how to address that yet, but it does seem to me that there's something like functionally different in those places.
But you'll be able to see comparable data county to county in Texas, where through the state, they're collecting the same, asking the same questions of the same sort of people at the same durations of time. And you're going to find usable data there.
I hope so. That's the goal. The plan is to definitely go back in and really comb through all of these places to make sure that the organizations that we're including are truly meeting what we're defining as the non-police crisis response types that we're interested in.
And for this project, we were really focused on services that are providing an in-person response that do not involve police.
Yeah, so much of mobile crisis, especially in rural areas, is becoming telehealth. It's really sneaking in under the wire here as states are not able to hire, retain, or deploy mobile crisis teams in the rural eastern Colorado is impossible. Lots of Alaska, upper Michigan, eastern Oregon, just not possible. Robert Parrish, my friend from Eugene, has a question in the Q&A. Robert, can you come in and ask your question?
Good afternoon. Robert Parrish here. I worked on the Cahoots program for 20 years now with Willamette Valley Crisis Care, working on bringing a crisis program back. But my question is sort of about any of those like losses of service. Do you have any, like, as you've been looking and trying to get an idea of services across the country, do you have data about programs that have begun but then lost funding? that could maybe be like investigated, not necessarily in this project, but for others to see like what happened there and how we might avoid some of those pitfalls and like allow those services that do continue to exist to like have more longevity and avoid those problems.
Super interesting and really important point. Thank you so much. So right now, the way that our CCBHC data is structured is it does allow for organizations to kind of come in and out of the data set based off of if they have a designation at that time. And so we are able to do that on the CCBHC side. So for instance, if an organization loses their designation for 2 years, they're out of our data set and then they come back in once they newly receive or they receive their designation again. We don't have that on the community safety response program side right now. But in theory, I mean, I would love to be able to create that more kind of longitudinal measure to have a better sense about what access looks like over time, as opposed to just a snapshot. And Therese, you could probably speak more about that side of things.
Yeah, right now in another project I'm leading, we're aiming to characterize several operational and outcome metrics of community safety response programs across the country. And one of those includes funding and how funding changes over time over the course of that program. So we're still early on in the data collection phase, so I don't have an answer to that just quite yet. But I do know of an advocate and community member in the field who has been really essential in helping us track programs, who has shared with me her learnings of when programs have stopped running and such. So that would be definitely a conversation, and I'm curious to get her thoughts, and maybe I can connect you to, because she, I think, would have that kind of insider information. But at this point, in terms of across the field and across the country, I'm not super aware of work that has looked at that just yet.
There are many surveys underway right now. It seemed like it was a good idea everybody had at the same moment. And Jordan mentions in the chat, are you familiar with the Columbia University Wayne State survey going on? Are you going to be able to cooperate and participate with Dr. Pope and Dr. Watson and their
Definitely, yes. Super excited about all of the work going on in the space to landscape the field. And Dr. Pope and Dr. Watson and co.'s survey is really an awesome, extremely comprehensive survey of the crisis response landscape more broadly. So I'm really excited to see what it shares. And there's been other work from other agencies like LEAP to map community safety response programs. We're working on another project to look at other factors related to community safety response programs. So I see these as being complementary. And I too have thought about what a survey would look like in this space, and really just wanting to make sure that whatever work is done complements and is not duplicative of all of the great work that's going on out there.
It's a really exciting time, I think, in the research area of this, little niche community, the information scientists. The big brains really are very cooperative right now with each other. They're very generous with their time, their energy. It's just a lot of camaraderie working right now. It's really a great moment to be doing research here. It won't
Yeah,
last.
I couldn't agree more. I hope it does last, and that really has been my experience, so I hope it does.
And you're able to communicate with colleagues all over the country and have a pretty good idea what everyone is doing at this point.
Yeah, I mean, I think there's so many impactful organizations in this space who do complementary but related work, and folks have really led initiatives to bring researchers together. And even Jason, your newsletter wrapping up all of the research from 2025 was a super helpful resource for me, and I think many others as well. So also this conference and the other conference that will be happening in June, I think are awesome spaces for researchers and advocates and programs in this space to come together and learn from each other.
It's really exciting. It's gonna the conference that we had last year in New York and we're gonna have in Chicago in a couple of weeks. months, excuse me, in June. It's really exciting to see all of the people thinking about this one very small thing all at once in one room together, all sort of buzzing in harmony. It was quite exciting to watch that happen.
Definitely. You could feel the energy in the air, and it was so invigorating being in a space with so many people really just focused on this area. And I think where Amanda and I's work and started to really converge, and we started to think about what's the space looking like from even a bigger perspective.
Exactly. As Therese said, we owe a lot to that conference in last May, right? Because that's where I met Jason. That's where I think Therese and I really started thinking through how we could do something together in our overlapping spaces. So definitely kind of recommend attending, as they're just really helpful spaces to share ideas and what you're working on.
I think that's really our task here at AMSA is to sort of get the conversation going. We don't know where it's going. Where it's going is up to you guys. We're just here to convene things and get things started. But let's talk a little bit about the research. A lot of folks here are practitioners. How does someone who's a practitioner who doesn't read science journals every day, how do they end up making use of this? Why is this important to do?
Super good question. And I think, Amanda, were you going to jump in?
No, you go first.
Yeah, I think a challenge for researchers or a duty is to make sure that this work can be translated. And I think a lot of the nonprofits in this space do a good job of helping to facilitate, the evidence into practice and to help inform how programs make changes or learn about one another. One initiative we are involved with at the Policing Project is integrating data that I'm collecting in a big national review with lived experiences of responders to integrate stories of the actual services with also other empirical data, and to put that out in a format to the public that's easily accessible and that can be navigated without having to read through a lengthy peer-reviewed article that might be behind a paywall.
Yeah, no, I think it's on people like Therese and I to really make sure that this work is one responsive to the people that are actually providing services and receiving care. And that's something that I think we're both really conscious about as we move forward with this project. And we might see that it really evolves over time because we learn that a particular question might be interesting to us, but not really meeting the needs of the communities that are providing services or receiving services. And so I'm really grateful to have connections in communities, and Therese particularly, I feel like is so tapped into that world. And so we just want to make sure that this work is responsive to the needs of the people who are listening to us right now. So if it's not, or if you think we could do a better job, we would love to hear from you.
Well, thank you so much for your work. We're looking forward to the report. We'll certainly distribute it in the newsletter.
Great.
Take care.
Thank you, as always, Jason.
Thanks so much.